Hey, it's Dr. Angelina with Georgia SurgiCare, SurgiCare Arts, and Ideal Body Institute. I'm triple board certified surgeon, and we're going to talk about breast reduction today. A very important topic, very common procedure, and probably one of the most satisfying and really rewarding procedures both for surgeon and the patient. Who qualifies to have the procedure? So most time what we see are either young girls, from age of 15, 16, 17, I've seen teenagers who develop their breast early, and usually it happens very early when it's genetic like that, and have very large breast to start with, or women really of any age, whether they had large breasts to start with, whether they gained weight and breast became larger, whether they had multiple kids and breast became larger, whether it's after menopause and same thing happened. So multiple different ways to get there. But once you're there, you know you have a problem. You have large breast, you can't find a bra to fit them into, you have to special order them sometimes, you are tired, you're carrying extra several pounds on your shoulders, you start to get shoulder notching, a lot of times patients get a lot of discomfort or very big build up strong muscles on your shoulders and your back and your neck. It hurts, it's tight, it causes pain. And as I said, daily activities could be compromised, sports, right, exercising, running. I had people say when I lay down flat, I feel like my breast about to choke me. And it is obviously a true fear because some breasts are very, very large and heavy and cause a lot of discomfort and pain. At what age should one consider the surgery? And answer is really when you're ready. There is no reason to wait forever. There are a lot of women who I've seen for the surgery who waited 20 years. They had the problem since they were teenager. They waited until they were in 40s, 50s. And looking back, they went, why did I suffer all these years? Why did I have to carry all this on my shoulders? So really, when you're ready, when you're really suffering, you have to make the decision. It is on you. But if it's causing you pain, if it's causing you so much discomfort, you can't fit into the clothes, you're self-conscious, there's so many other reasons, I would say at least address it with a surgeon and get some guidance, and then they can help you to decide whether it's time now or you should wait. A recovery for surgery like this is relatively short. Surgery itself may take a couple of hours, again, plus minus, based on your surgeon, based on location, based on size of your breast. I usually say average of 2 hours. It could be a little faster, it could be a little longer. I do like to put my patients to sleep for general anesthesia. It's easier for everybody. It's easier to tolerate. It's safe as long as you're healthy. Otherwise, obviously we make sure we screen our patients for that. Then it's relatively easy recovery afterwards. I would say about 2-3 days where you might take some pain medicine. A lot of people don't even require strong pain medicine. They can get away with medicine from over the counter, so your regular ibuprofen and Tylenol, and it works well. And again, because that other pain is gone from your back and shoulders, most people don't even realize if there is a little soreness on the breast, usually a little burning sensation, a little soreness, but it goes away relatively quickly. Healing happens over a period of several weeks overall. You might have some tape or dressings, depends on your surgeon, for a little while. You will not be able to bathe, go into the water like jacuzzi or pools for several weeks usually while incisions are fully healing. The pricing of the surgery. So I will talk about pricing here in SurgiCare Arts Ideal Body Institute centers. On average, in my practice, it's about $9,000 or so. It could be about $85,000 to $10,000. My prices include everything, meaning it includes your surgeon's fee, the operating room fee, anesthesiologist fee, any staff medication that you require during your surgery and procedure, the follow-ups and your pre-op visits. If you go to the hospital when you don't have insurance and you have to pay out of pocket, then prices usually go up. In outpatient surgery centers, we're able to control costs better, and so prices overall lower. If you go to the hospital, you're probably looking at least 60% more in price, so you're looking anywhere between $16,000 to $25,000 for surgery like this in the hospital facility.